We'll now look at HoNOS profiles for different mental health services to help understand how the profiles can differ for each service and how to analyse the data effectively. This data shows the improvement or progress people have made whilst in an inpatient unit using aggregated profiles. Remember,
the red line shows the aggregation of initial ratings. The blue line shows the aggregation of ratings at discharge.
The effect size is shown in the coloured boxes. The graph only includes ratings with an initial minimum score of 2. Looking at the HoNOS profiles and effect size for adult acute inpatients, the most significant improvements are in agitated behaviour, scale 1, self-harm, scale 2, and living conditions, scale 11. This would be expected, as people who are admitted to acute wards are more likely to be agitated or distressed and/or to have recently experienced an incident or thoughts of self-harm. It would be expected that treatment on the ward would help reduce scores for both of these. Treatment on an inpatient unit wouldn't necessarily directly improve accommodation, but in order to support discharge planning, there would need to be stable accommodation, and so accommodation status, scale 11, should improve during an admission. This data shows the improvement or progress people have made whilst using early intervention in psychosis, EIP services, using aggregated profiles. As seen on this chart, the change from initial scores, the red line, and discharge scores, the blue line, as measured by effect size, are similar to those seen in adult acute. The initial scores are slightly lower than for adult acute across all HoNOS scales. Looking at the HoNOS profiles and effect size for EIP, there are clinically significant improvements across every HoNOS scale. The most significant improvements are in agitated behaviour, scale 1, self-harm, scale 2, problem drinking and drug use, scale 3, and living conditions, scale 11. On this chart, there's also improvement in psychotic symptoms, scale 6, This data shows the improvement or progress people have made whilst in a community mental health team, CMHT, using aggregated service profiles. One would expect that the initial scores when a person enters the service would generally be lower than for adult acute services. The case mix of CMHT teams is likely to be broad, with a wide range of needs. This graph provides an aggregated view of a London Trust CMHT service, covering all diagnoses. Trusts may wish to further analyse their CMHT data cut by diagnostic code. Looking at the HoNOS profiles and effect size for people using CMHT, there are clinically significant improvements across many HoNOS scales. There are clinically significant improvements in some areas such as agitated behaviour, scale 1, self-harm, scale 2, cognitive problems, scale 4, activities of daily living, scale 10, and living conditions, scale 11. This data shows the improvement or progress people have made whilst in an older adult service with aggregated scores, which is a service for treating mood and psychotic disorders as well as cognitive disorders. Looking at the HoNOS profile for older adult, there are clear improvements on some scales such as self-harm, scale 2, hallucinations and delusions, scale 6, relationships, scale 9, and living conditions, scale 11. There may be no or limited improvement in scales such as cognitive problems, scale 4, physical health problems, scale 5, and activities of daily living, scale 10. This may be due to the nature and life course of conditions in older people. For example, dementia is a progressive illness, where some of the symptoms may not improve or may even deteriorate following the initial assessment and treatment. The case mix of older adult services is likely to be broad, as it treats both mood and psychotic disorders as well as cognitive disorders. Trusts may wish to split their data, for example, into the memory service, which primarily focuses on dementia and cognitive disorders, and the general older adult service to see if there are different profiles and outcomes. We've done this here as an example. On review, the profiles for both graphs are very similar. However, this may not be the case for older adult services in other trusts. Trusts can carry out analysis and decide whether it's worthwhile to split up the data for individual services, for example by team type or diagnosis. For general older adult data, it's important to note that this particular data includes older adult CMHTs and the older adult challenging needs service, which may also include people with dementia.